Hi friends, welcome for bone marrow transplant session. We are all afraid of bone marrow transplant and we don't know much about bone marrow transplant. But we have to remember in 2025, bone marrow transplant is the curative modality for many people suffering from blood cancer. We have got high risk blood cancers like leukemias, acute myeloid leukemia, acute lymphoblastic leukemia, where your disease wants a bone marrow transplant. So it cannot be treated only by chemotherapy, and that's how the genomics helps us in characterizing which requires bone marrow transplant. So bone marrow transplant is not a surgery, it's not breaking the bones, it's just a plain simple blood transfusion which you take it from one hand and transfuse in the other hand, and the donor does not have a problem. So what kind of a bone marrow transplants which we have, which is like autologous, which is self, which means that every multiple myeloma, and mark my words, every multiple myeloma patient requires bone marrow transplant, which is autologous. And you know why? Because chemotherapy can only give you a survival of 36 months. But when you combine chemotherapy with bone marrow transplant, wow, voila, 76 months. And that's what the data is. So it means multiple myeloma can get prolonged. Lymphoma patients who have relapsed, DLBCLs who have relapsed after 12 months needs bone marrow transplant. T-cell lymphoma, from 30% the survival increased to 60%. Of course not 100%, but it increases to 60%. And then the latest in thing, because the understanding of body's own immunity, which happens in multiple sclerosis and systemic sclerosis, one can get an autologous bone marrow transplant. And fortunately, we are the largest bone marrow transplant center for autoimmune disorders in complete Southeast Asia and other parts of CIS. So you see, the multiple sclerosis and systemic sclerosis can get a bone marrow transplant done. That's auto. Once you have a leukemia, I cannot take your own cells. So I have to rely on my brother and sister. And what is matching what is required is not the blood, not the clothes, not your mindset, not your eyes. But what is required is HLA. Remember the word called HLA. High resolution HLA is required so that a donor can donate 300 ml of blood, which 300 ml of blood is safe for the donor because they can give up to 600 ml of blood. So it doesn't happen anything to the donor. It is not like taking out your kidney or liver. So bone marrow transplant is not a surgery, is a way of curing blood cancers, which requires the transplant by virtue of knowing your genomic studies for a blood cancer. And that is how we together work over a period of 3 weeks to 3 months to bring a cure to these patients. So ask your doctor for early treatment by these newer technologies of bone marrow transplant. Thank you.